Modern science is catching up to what herbalists have long known. Certain plants can offer remarkable support to the liver, helping reduce inflammation, promoting detoxification, and even encouraging tissue repair. In this lecture, we will explore the stages of liver damage. Muitas curaira, inensas, fatty liver, liver fibrosis, and cirrhosis, along with natural, herbal, and holistic nutrition strategies to support liver health at every stage. The liver, your internal chemical factory. Functions of the liver. Filters blood from the digestive tract. Breaks down and removes chemicals, hormones, and waste. Produces bile to carry waste and break down fats. Stores vitamins A, D, E, K, B12, and minerals, iron, copper. There are two phases of liver detoxification. In phase 1, enzymes like cytochrome P450 transform toxins into intermediate compounds. And in phase 2, conjugation pathways neutralize these intermediates, making them water-soluble for elimination. Signs of poor liver function or toxic overload. Fatigue, headaches, skin issues, acne, rashes, bloating and digestive issues, brain fog, hormonal imbalances, sensitivity to smells or alcohol. Now, let's take a look at some of the stages of liver damage, including some holistic approaches and strategies to support liver health at each stage. Fatty liver disease is one of the most common liver issues worldwide today, affecting millions, often without any noticeable symptoms at first. It can develop silently for years before serious health problems arise. So, what is fatty liver disease? In short, it's a buildup of excess fat in liver cells. There are two main types. NAFLD, non-alcoholic fatty liver disease, not related to alcohol intake, and AFLD, alcoholic fatty liver disease, caused by heavy alcohol use. Some common causes and risk factors are overeating processed foods, especially sugars and refined carbs, obesity and metabolic syndrome, type 2 diabetes and insulin resistance, high cholesterol or triglycerides, excessive alcohol consumption, sedentary lifestyle, toxin exposure, such as environmental chemicals and certain medications. So, why is fatty liver dangerous? It can lead to liver inflammation, steatohepatitis. It may also cause liver scarring, known as fibrosis, and may lead to cirrhosis. Having a fatty liver increases risk for heart disease, diabetes, and liver cancer. Fatty liver can be reversible if caught early. While many people may show no symptoms early on, there are some things to watch for. First, fatigue discomfort in the upper right abdomen. Second, unexplained weight loss. Next, elevated liver enzymes on blood tests. And brain fog or feeling sluggish. Now, let's take a look at nutrition. A high-fiber, anti-inflammatory diet with lots of vegetables, low glycemic fruits, and lean proteins will help your liver into recovery. It's important to cut back on sugar, refined carbs, and unhealthy fats. Include more liver-supportive foods such as beets, leafy greens, cruciferous vegetables, and garlic. Exercise. 30 minutes a day improves insulin sensitivity and reduces liver fat. Weight loss, even 5 to 10% body weight, can drastically improve liver function. Remember to stay hydrated. Hydration flushes toxins. And herbs such as milk thistle, dandelion root, and turmeric provides a gentle healing support. Just be sure to consult with a naturopath or herbalist for contraindications. Liver fibrosis is a serious, often silent condition where healthy liver tissue is gradually replaced with scar tissue. It's the body's natural response to ongoing liver damage, but if the damage continues, fibrosis can progress to cirrhosis, liver failure, and even cancer. Liver fibrosis is the formation of excess scar tissue in the liver due to repeated injury or inflammation. Fibrosis is not a disease itself, but rather the liver's attempt to heal. Fibrosis is also potentially reversible in the early stages. Some main causes of liver fibrosis is chronic hepatitis B or C infection, fatty liver disease, especially NASH, non-alcoholic steatohepatitis, long-term alcohol abuse, autoimmune liver diseases, repeated exposure to toxins or medications, certain genetic disorders like hemochromatosis. 3. How does liver fibrosis progress from a healthy liver? It starts with a mild fibrosis leading into a moderate fibrosis, then finally ending at gut cirrhosis, where we see the most severe scarring of the liver. As more scar tissue forms, blood flow through the liver is blocked. Liver function decreases, such as metabolism, detoxification, and hormone balance are all affected. End-stage liver disease leads to liver failure or the need for a liver transplant. Like fatty liver disease, oftentimes there are no obvious symptoms of liver fibrosis until significant damage is done. Still, it may be helpful to be mindful of certain symptoms such as fatigue, easy bruising or bleeding, swelling in legs, also known as edema, swelling of the abdomen or ascites, jaundice, which is yellowing of skin and eyes, itchy skin, loss of appetite and weight loss, and confusion. This would be due to toxin buildup. So remember, fibrosis can be reversed in early stages. Strategies to stop or reverse the progression of fibrosis. First is to remove the cause, such as eliminate alcohol, control blood sugar, or treat hepatitis. Incorporate an anti-inflammatory and antioxidant-rich diet. Use of specific herbs shown to support liver repair, such as milk thistle, licorice root, and schisandra berries. Regular, moderate exercise to improve circulation and reduce fat deposits. And seek treatments for underlying infections if necessary. The liver is one of the only organs that can regenerate itself, but only if we give it the right environment to heal. Cirrhosis is late stage of liver disease marked by severe scarring and irreversible damage. The liver, once a powerful detoxifier and metabolic center, becomes stiff and scarred, affecting nearly every system in the body. Liver cirrhosis is defined as having chronic, progressive scarring or fibrosis of the liver that severely impairs its ability to function. Scar tissue replaces healthy liver cells. Blood flow through the liver becomes blocked, causing widespread damage. The main causes of cirrhosis are chronic alcohol abuse, alcoholic liver disease, chronic viral hepatitis, especially hepatitis B and C, non-alcoholic steatohepatitis, referred to as NASH, and advanced fatty liver disease, autoimmune hepatitis, certain genetic diseases such as hemochromatosis or Wilson's disease, and long-term exposure to environmental toxins or certain medications. A few symptoms of cirrhosis, though, symptoms often appear only after significant damage are fatigue and weakness, loss of appetite and weight loss, nausea, edema, swelling in legs, feet, and ascites, fluid in the abdomen, jaundice, yellowing of skin and eyes, itchy skin, easy bruising and bleeding, confusion and or memory loss, and the appearance of spider-like blood vessels on the skin. Complications of cirrhosis can lead to liver cancer, liver failure, internal bleeding from varices in the esophagus or stomach, kidney failure, increased infections, osteoporosis, and diabetes. It is important to understand that early fibrosis can sometimes be reversed with lifestyle changes. However, cirrhosis is typically irreversible, but its progression can be slowed or even halted with proper management. In severe cases, a liver transplant may be the only option. For prevention and management, you must stop any and all alcohol intake completely. Maintain a healthy weight, manage diabetes and cholesterol. Eat a nutrient-dense, low-inflammatory diet. Avoid unnecessary medications, especially over-the-counter painkillers like acetaminophen, commonly known as Tylenol. Vaccinate against hepatitis A and B. And regular liver function monitoring with your naturopath. Your liver can handle a lot, but it has limits. Once those limits are crossed, the road back to health becomes much harder. Prevention is always easier than repair. Detox is a buzzword today, but real detoxification is not just a juice cleanse. It's an everyday biological process essential for life. At the center of it all is the liver, the body's metabolic powerhouse. Understanding how to support the liver can help us optimize health, prevent chronic disease, and improve energy and resilience. Herbal support for fatty liver. The goal is to reduce fat buildup, lower inflammation, and improve insulin sensitivity. Key herbs are milk thistle, Silybum marianum, a powerful antioxidant which protects liver cells and may even assist with regenerating damaged liver tissue. Turmeric, curcuma longa, an anti-inflammatory that supports bile flow. Dandelion root, Taraxacum officinale, enhances bile production and gently detoxifies the liver. Green tea extract is high in EGCG, epigallocatechin gallate, supports fat metabolism and reduces oxidative stress. And schisandra berries, Schisandra chinensis, these are adaptogens, which protects against chemical damage. Herbal support for fibrous liver fibrosis. Goal: halt progression of scarring, improve regeneration, lower oxidative damage. Key herbs: milk, thistle, still vital, proven to reduce fibrotic changes. Bupleurum, Bupleurum fulcatum, used in traditional Chinese medicine to improve liver qi and reduce inflammation. Artichoke leaf, Cinera scalamus, enhances bile production, protects against further tissue damage. Licorice root, Glycyrrhiza glabra, anti-inflammatory and antiviral support, especially important if hepatitis is a cause. Astragalus, Astragalus membranaceus, strengthens immunity and reduces fibrosis progression. Herbal support for cirrhosis. Goal: manage symptoms, protect remaining healthy tissue, and support detoxification gently. Key herbs: milk, thistle, continues to be primary herb. Cordyceps mushroom, supports liver and kidney function. Reishi mushroom, reduces inflammation and protects against oxidative stress. Dandelion root, gentle liver and kidney detoxification, helps with edema/ascites. Silymarin-based blends, often used alongside conventional medical management. Important safety notes for students. Herbs cannot reverse cirrhosis, but they can slow progression and ease symptoms. Always check for drug-herb interactions, especially if patients are on medications. Dosage matters. Too strong detoxification can stress a severely damaged liver. Start gentle. Work holistically. Herbs plus nutrition plus lifestyle changes. For carcinoma, liver cancer. Goal: support the body's resilience, minimize oxidative damage, enhance detoxification, and assist conventional care, not replace. Key herbs: milk thistle, high silymarin concentration, has shown protective effects against liver cancer progression in preliminary studies. Turmeric, curcumin, potent anti-inflammatory and studied for anti-tumor effects. Green tea, Camellia sinensis, EGCG compound may inhibit cancer cell growth. Astragalus, supports immune response and helps protect against chemotherapy side effects. Reishi mushroom, immune modulating and antioxidant, used traditionally in cancer support. Medicinal mushrooms, such as maitake and shiitake, support natural killer NK cell activity and general immune health. Important notes on carcinoma support. Herbal therapies must complement, not substitute, oncologist-prescribed treatments. Monitor for drug-herb interactions carefully, especially if using chemotherapy, radiation, or immunotherapy. Focus on immune support, inflammation control, and liver cell protection. Herbal dosing should be gentle and supervised by a qualified practitioner if active cancer treatment is ongoing. The liver is a central organ. The liver processes everything you eat, breathe, and absorb through your skin. A nutrient-rich, anti-inflammatory diet reduces the burden on the liver, while poor nutrition forces it to work harder to detoxify harmful substances. Holistic nutrition doesn't just help the liver survive, it helps it thrive by providing the right environment for natural healing, optimal detoxification, and regeneration. The liver needs specific nutrients like B vitamins, magnesium, zinc, glutathione precursors for phase 1 and phase 2 detoxification processes. Without enough nutrients, toxins build up in the body and can damage liver cells. Gentle daily detox from foods like cruciferous vegetables, garlic, and fiber is safer and more sustainable than extreme detox fads that can actually harm the liver. Chronic inflammation is a root cause of liver fibrosis and cirrhosis. Holistic nutrition emphasizes foods rich in antioxidants, omega-3 fatty acids, and phytonutrients that lower inflammation naturally. Poor blood sugar control, insulin resistance, leads to fatty liver. Whole foods like leafy greens, healthy fats, lean proteins keep blood sugar and cholesterol in a healthy range, preventing fat buildup in the liver. Morning routine. Warm water with lemon or apple cider vinegar. Optional: milk thistle, extract capsule. Breakfast: green smoothie, spinach, cucumber, avocado, green, apple, flax seeds, lemon. Herbal tea, green tea or dandelion root tea. Just take a quick glance here at the sample lunch and mid-afternoon snack suggestions. We have some yummy, beneficial bitter greens, proteins, healthy oils and fats, and healing herbals. A sample dinner plan might include cruciferous vegetables, protein, and detoxing herbs. A nice finishing tea before bed might be a relaxing chamomile tea or reach for the adaptogenic reishi mushroom. We have a magnesium supplement here, which is also great for restful sleep or preventing leg cramps. Liver healing isn't just about what we take away. It's about what we nourish, strengthen, and gently rebuild over time.